So I know this is a little bit controversial, and maybe we've heard debates about this, but do you think resectability needs to be determined at the time of presentation, or can you reassess after receiving neoadjuvant therapy?
I mean, I think that probably down the road that we will make that decision, like we might be a little more aggressive, and I think we're more willing to call someone borderline resectable when truthfully they're not resectable, but you're hoping that they're going to be. I think it's optimistic, but I think as these immunotherapy drugs, do a really good job at shrinking our tumors and making things more resectable, that's a possibility.
Yeah, I agree. I think we have to be careful, right? Because a lot of these trials, they only looked at those patients who were deemed resectable. And so I think the borderline or trying to downstage too much can become kind of like a dangerous area.
Sure.
Because we do know we have Pacific, we have these good outcomes with chemotherapy, radiation, followed by immunotherapy in driver-negative cancers. So we don't want to deviate too much from the literature, although I agree it's very interesting.
It's certainly a difficult balance, and I think there are so many nuances that we don't talk about, that aren't written about, because when you downstage someone or you're trying to see a great response, sometimes if what you're seeing, what you're hoping to see is, kind of the separation of the primary tumor from hilar nodal disease so that it's no longer just one big mass, that really might be taking something that wasn't resectable and now making it resectable. But then there are other situations where it may be very different. So it's certainly quite nuanced, and I don't know that we know all the answers yet, but.
I think some of the work you're doing, like with consolidation and maybe a peri-op strategy, could radiation come after, So I think there's a lot of really interesting questions and trials in the works that will help address some of these.
For sure. I mean, we could talk about this really for the rest of the time, but I think more than anything, like what we're realizing is how important it is for us surgeons to be involved in these discussions at our conferences, on the papers that are being written, and at our tumor boards most especially.